Okay. Hi, I'm Christiane Truelove, Editor-in-Chief of MedAd News, and I'm here today with Alexandra von Plato, President of Digitas Health in Philadelphia. And we're here today to talk about top women in healthcare advertising, how they got here, and what they encountered along the way. I'm very thankful for Alex for agreeing to this interview.
Well, thank you for inviting me, and thank you for coming down to visit us. It's really nice to have you here.
It's great to be here. So we might as well get right to the questions.
Sure, I'd love to.
Okay. What attracted you to the healthcare advertising business, and what are the things that continue to keep you interested and involved?
Yeah. Nothing attracted me to it. Absolutely nothing. As a young producer and creative person, there was really nothing to like about it. There was nothing to aspire to. It didn't even enter into my radar screen when I was younger. I did get involved in a very boutique-y agency at the time that was called Medical Broadcasting Company. Mm-hmm. And the agency had asked me to develop some program content. And as a producer and as a creative development person in television, so my first experience was to put a television show together with Prevention Magazine for national syndication. And what happened was we ended up doing 26 episodes of this program with a friend of mine named Mike Rowe, who's now famous on the Discovery Channel for Dirty Jobs. But Mike and I invented this format that basically we called him the embedded host. So what I did was I subjected to him to every healthcare treatment, every massage, every vitamin regimen, and then he would just tell the audience what he thought about it. And so it was a really fun format. It was a different kind of format for health information. And it got me into the health content side of the business. Now again, this was pre-internet, pre-digital, but it was very much about content. And what happened from there was I learned a lot about healthcare information, healthcare publishing, healthcare editorial on the consumer side, and then digital happened. And the Medical Broadcasting Company agency made a commitment early on to follow digital all the way down the road. Just when DTC happened and was healthcare communications got deregulated for consumers is when Medical Broadcasting Company decided not to follow their heritage in advertising as spot producers, but to follow the internet. And that seemed really compelling to me, especially since I had just produced 26 half hours of content and was learning about longer formats and different kinds of ways to present health information. So that's really what got me into it. Television, ironically, got me into the internet and kept me here as we've watched the role of digital media influence decision-making across the whole stakeholder group, whether it's a physician or a caregiver or a patient or a managed care person working in managed markets, the role of how we inform our decisions and make decisions today, where we get our information from, who we trust, and the way marketers need to really participate in helping get into conversations with the right people in the right time frames. So that all kind of started to merge and converge, and it's kept me vitally interested in the conversation and in the transformation of healthcare marketing.
Okay. When you first started in advertising, what were your career goals? Was it always your goal to become a CEO or president or managing partner? Was this a realization that came gradually?
It was never a goal, I would describe it, it came gradually with having more of a complete, it's never going to be complete point of view, but more of a complete point of view about where the industry is heading, where the opportunities are, what kind of people, what kind of talent do we need to bring to bear on solving these problems for our clients, creating these new kinds of points of engagement for physicians and consumers, understanding where the opportunities are in the patient-doctor dialogue and how that really is the moment of truth in healthcare, and get some different kinds of people thinking about that problem and opportunity that weren't necessarily people who got up in the morning and said, I wanted to be in healthcare, but could be brought to bear on healthcare in a way that would be exciting for them, that they could get enthusiastic about and would, clearly would have to bear fruit for our clients in a new and different way. So I didn't really plan to be a president or a CEO. I planned to just be part of a company that was working on more of the front edge of where all this digital media intersected with healthcare, and that's what kept me interested. And as my point of view grew and as I got more ornery about what I thought, and I was more demanding about making sure that went front and center, I sort of just, everybody just started to say, okay, you be in charge then.
One thing I've noticed about the healthcare advertising industry, and probably the advertising industry in general, there seems to be a higher number of women in the C-suite compared with pharmaceutical companies. Could you share some of your theories as to why this is the case?
I find that very gratifying to hear. I don't think I ever knew that until you just mentioned it.
I mean, if you go through the April issue and you look at the advertising agencies, you're like, woman, far more than you'd ever see out on the pharma side. So
I never really put that together. It's a great thing to hear. Well, I think the subject matter when it comes to marketing and it comes to engaging audiences, and I think, the subject matter, there's a lot of empathy, there's a lot of compassion. If you're in advertising and, you can work on fear, or you can work on, helping a parent decide what kind of flu vaccine to give your kid. I think that some of the subject matter just seems more appealing and relevant to women who might have had, life experiences that include children or include family. And, the target audience for a lot of what we do happens to be women. So it seems like there's a natural fit from the subject matter standpoint. And I'm wondering if that has something to do with it. The other thing in our particular business that I find interesting, and that perhaps there's some advantage from a gender standpoint, is we mix so many different disciplines together. And we really, there's so many different variations of expertise in this work, and you really have to be able to be comfortable with your own lack of authority in any one given space, and you really have to be able to index on, creating an atmosphere where people are comfortable and can collaborate and can bring everything they have with their egos and all their experience to bear in an environment where it's about sharing. And I'm wondering if that has anything to do with it. I'm not sure. I mean, I think, my sense is that all women are different and all men are different, so therefore all people are different. So I really don't generally subscribe to women are like this and men are like this. I've worked with some very sensitive and careful and caring men who've also been attracted to this business for some of the same reasons that I just mentioned. I think, women might find it sympathetic with some of their values.
So it's less about command and control and more about collaboration, so the people who are more attracted to collaboration wind up in here. So
I think so. I mean, I came through this as a creative director into management, and I can tell you that, it's not a bravado creative job. It's a deeply complex problem solution creative job. And there's a lot of information, intensely complex and complicated information from experts whose expertise you're never going to amass. We have 4 physicians on staff here who also happen to be filmmakers and MBAs and pediatricians, etc. So you have to be able to really kind of sit back and put your ego at the door and be a sponge for a lot of things that move you very quickly out of your comfort zone. So I think that kind of atmosphere attracts different people for different reasons, and apparently a lot of them happen to be women, which I'm thrilled by.
When it comes to management styles in this industry, do you think there is a difference between women and men, or is it just a difference between people in general?
I think it's a difference between people, as I mentioned. I'm sure that there are a lot of command and control focused, female executives, and I'm sure that there are a lot of collaborative, interpersonal relationship oriented male executives or men. So I really don't see it as being a gender issue. I do think what is a gender issue for across industries is that, women continue to find a seat at the table, if not the seat at the head of the table in greater numbers, that the confidence that there's a place for women and that there's not going to be a gender bias. I don't know if there's a gender opportunity. I don't know if it cuts on the opportunity side, but I do think that there's been advances in terms of there's not as much of a bias, and that women can make the decision that they want to continue their careers into a C-suite aspiration and do it, and that's wonderful. And I happen to think healthcare is a great place to do it because there are so many things that a lot of women through their personal lives as the head of the household when it comes to healthcare decisions can relate to very deeply and very authentically.
Working women with families have always had to balance their home and work life. How have you been able to achieve this balance as your job responsibilities grew?
I don't achieve it. It's an aspiration. It's a real-time calibration. It happens every single day. You make choices in favor of one thing or another, and you let yourself off the hook, for that kind of psychological jail that this week I didn't choose enough in favor of the kids. Next week I didn't choose enough in favor of my work. You're going to face that every single day, and you really need to trust yourself. I think that the great disservice women do to themselves, and I think some of the press and popular culture has done to women, is the sense that there is balance, and if you were only doing it right, you would achieve the balance too. You must be doing something wrong because you're not as balanced as somebody on television that I just saw interviewed on Oprah seems to be. And I think it's a myth. I think that you just have to steel yourself for the day-to-day decision making and trust yourself. And the other thing I tell myself when it comes to children, and I have a stepson and 2 small daughters, and is that when I make decisions in favor of work, or when work is compelling me to travel or be out of town, or have a whole week of late nights, etc., I try and understand that in terms of I'm role modeling something for them. The best thing I'm doing for them with my career, other than providing a lifestyle for them, is I'm showing them what it looks like when somebody loves what they do. And I hope that's a gift to them. And I hope that they'll be able to follow that and say, my mommy liked her work. My mommy was enthusiastic about it. She got excited. She was into it, And I think that that hopefully will be something that, they take away.
What are 3 pieces of advice that you'd give anyone starting or trying to start a career in healthcare advertising?
That's a great question. I would say be a student of the medium, of the media, of the subject matter. Use your own life as inspiration. A health problem that you've had to overcome, a health problem that a family member had to overcome. Invest in something personally and use it to inspire you to get informed and follow your own experience, because how people make decisions and form opinions today is informed by so many touch points. And I think the most important insight you can get in marketing today is the notion that what's important to you as the patient, as the decision maker, is what matters now. What the doctor says matters a lot. What the drug company says matters a lot. What some third party or some ethical medical institution matters a lot. But at the end of the day, you're synthesizing all of that and deciding what's right for you. So I would tell people, walk a mile in those shoes. Pay attention to how you triage a problem for yourself and use that as inspiration to take to your next job interview, to take to your job search. And look for, if that fires you up at all, look for the companies who care about that. You know, and there are a lot of them out there. I just saw John Scully give a keynote address at CES in Vegas. And, you know, he's the famous CEO of PepsiCo and Apple, etc. And he's looking almost exclusively at the healthcare sector for the next push in innovation in technology and communications technology. Because the amount of conversation and the amount of, you know, information exchange that's required for consumers and professionals and institutions to make good decisions today is ramping up rapidly in healthcare. And there's so many opportunities for innovation. And, you know, it's important to really examine that whole landscape, and hopefully, you know, if you find yourself getting excited about it, then it's probably the right thing for you. If you find yourself just looking for an industry that looks safe and looks like a, you know, a safe bet, not so much with healthcare anymore. You know, it's a dynamic time, and hopefully a lot of dynamic people will seize the opportunity to get in.
Okay. What do you think are the skills needed to rise to the top in healthcare advertising?
You know, I think, as I mentioned a minute ago, Chris, intellectual curiosity is, I think, at the forefront. I mean, I approach things from a very right brain side, and so my bias, which, you know, is on display here, is that that, you know, you have to really care about what you're doing. You have to be able to find a way to connect emotionally with what matters in our business. I think we get very wrapped up, as we should, in the numbers, in the, you know, in the performance. But what drives the performance is the commitment and the passion and the deep belief that what you're doing makes a difference and matters to somebody. So I personally respond to people who have that, can make that connection, and can bring, you know, their own personal experiences to the table. There's lots of times there's a bias. It's like, well, we have to talk about the research. We can't really talk about why it means anything to you, as if like your data or an anecdote from, you know, 1 or 2 or 10 people that you know, or patients that you've met, or physicians that you've talked to, is somehow less valuable. And I think that, you know, being inspired by the experience of other people and the experiences you have in exchange with other people is, I think, going to be a big key to, you know, breakthrough work now and going forward.
Okay. Describe attitudes towards women working that you saw at the beginning of your career and women now. Has anything changed, and has anything stayed the same?
I think some things have changed. I mean, I think one of the things that have changed is that, you know, women are clearly more confident. Women are not expected to, you know, not come back after their second baby. Women are not, you know, expected to, you know, just lose their competitive edge or their ambition, you know, after, you know, so many children or any children. I think in the beginning, when I first started my career, it was sort of a very expected thing that, you know, if you were going to have kids, you were going to go home, or you were going to go do something easier, because this advertising thing is, you know, very demanding. We're very deadline oriented, a lot's riding on what we're doing. We're in the service business, so, you know, we're really service driven. So we work to our clients' schedules and our clients' demands. I mean, hopefully we work ahead of that curve, but, you know, when you're on the service side of the business, you don't set your calendar every week perfectly and have it all lay out for you. Things happen, lots of things that are out of your control. So just speaking on the side of working moms, you know, I think the expectation that, you can continue to work has changed dramatically, and that's been a good thing. And a lot of young women say to me what I will say Laura Lang, who was my former CEO at Digitas, who just recently became the CEO of Time, said when I asked her earlier in my career, how do I do this? And she said, get upstream, push harder now to get a bigger job sooner. You have to work your way through the system to get to the point where you can own a little bit more of your calendar. And it seemed counterintuitive. I was like, how do I do that? I'm swamped. I have 2 babies. I'm in the middle of 8 pitches and 6 demanding deliverables. And she's like, just do it. Just do it and know you can do it. Don't let anybody tell you can't. And I think that was very liberating. It's like, just do it. You will come out the other end. It's just, you have to try. And I think what we have is we have this tyranny of the sense of balance, which I do think is a tyranny. It's like, oh, it's too hard, or I'm sacrificing too much, or it's not going the way it goes in magazines. It doesn't go that way. You're going to have days where you go home, I hate to admit this, crying, Not that every woman cries, because I know many of them don't cry at all. But, and you're going to have days where you feel like a hero. And you take them all. But the key is to believe in yourself and to feel like you don't have to quit, because you don't. Because now we live in a world where we can make accommodation, and when you get to a certain point in your career, you have a little bit more control over your own priorities, which makes it a little bit easier.
Great answers.
Sure.
Thank you again,
Yeah.
Alex. Again, this is Chris Truelove with MedAd News with Alexandra von Plato from Digitas Health. And again, we thank Alex for sharing her wisdom and her experiences in life and in healthcare advertising with us.
Thank you so much. It was great talking to you.
Thank you.
Thanks again. It was a pleasure.